Hi, my name is Dr. Bart Willems. I'm with the Division of Community Health at Stellenbosch University.
Are all types of TB that you get the same?
No, definitely not. You get different types of TB, and especially in the last couple of years, there are more and more TB transmitted between patients that are resistant to the normal antibacterial or antimicrobial drugs.
So what does this mean for the patient?
Well, this normally means that the cheapest and very commonly available drugs won't work if it's taken by the patient.
What drugs does the patient need to take instead, and is it more expensive?
Once the healthcare system or the healthcare workers learn that a patient has got TB that is not susceptible to the first line of drugs, we call that TB multi-drug-resistant TB. And it's also possible to get extensively drug-resistant TB, and that just links the TB bacteria's resistance to the commonly known drugs. Basic treatment, as I said, is 6 months. People with multi-drug-resistant TB would need more drugs, often medicines that are injected. Treatment is not for 6 months only, but could take up to 2 years. And unfortunately, these drugs, because they are stronger, they have more side effects to the human body.
Like what side effects?
The most common and quite worrying side effect is the sudden loss of hearing.
And is that a permanent loss of hearing?
Unfortunately, that's a permanent, irreversible loss of hearing.
There's a new drug in the market, right, that doesn't have that side effect, but it's not widely available yet.
There are a few new drugs available in South Africa. One very commonly known is bedaquiline, and that could be used to replace the drugs that give the side effects of hearing loss.
How much more expensive is it to treat a patient with multi-drug-resistant TB as opposed to ordinary TB?
In South Africa, around about 2013, so the treatment for drug-susceptible TB for 6 months was about 350 Rand. The treatment for multi-drug-resistant TB, only the medicines, is about 50,000 Rand, and the treatment for extensively drug-resistant TB is about 80,000 Rand.
And what is the cure rate of people with multi-drug-resistant TB?
There are different cure rates, but the cure rates could be as low as 50%.
Why is it so low?
At the moment, we don't have effective drugs to treat extensively and multi-drug-resistant TB.
It's not because patients don't take them?
It could be because patients don't take them, but because the drugs have very toxic side effects, it's very easy for people to decide to stop taking the treatment, because often the medicines make the patients feel worse than the TB itself.